can happen at any moment, and knowing basic first aid skills can make a crucial difference. First aid is the immediate assistance provided in emergencies until professional help arrives. In this video, we'll demonstrate 4 essential first aid skills that everyone should know.
Treating burns, helping a choking victim, stopping bleeding, and performing CPR. So, let's get started.
Burns on the skin can be caused by dry heat such as contact with fire, an extremely hot surface, or prolonged unprotected extreme exposure to the sun. Meanwhile, a scald can be caused by contact with wet heat, like steam or hot drink. Professional emergency responders advise that the longer the burning occurs, the injury becomes more severe. Their priority is to cool the burn as quickly as possible.
First, move the person away from the heat. Place the burn or scald under cool or lukewarm running water for at least 10 minutes as soon as possible. Remove jewelry and clothing around the area unless stuck to the burn. Cover the burn loosely and lengthways with kitchen film to prevent infection.
Here are some tips on what not to do in treating burns and scalds. Do not use ice or ice water. It can cause further tissue damage. Do not apply any ointment or any greasy substances like butter. Don't break blisters. Blisters help protect against infection. If a blister does break, gently clean the area with water and apply an antibiotic ointment. Do not try to remove clothing stuck to the burn, as it can cause further damage.
When someone is choking, their airway is partly or completely blocked, meaning they may be unable to breathe properly.
If an adult is choking, hit them firmly and sharply with the heel of your hand up to 5 times on the upper back between the shoulder blades. If blows to the back don't clear the blockage, apply the abdominal thrust known as the Heimlich maneuver. With both hands, hold the person around the waist and pull inwards and upwards above their belly button to force air up and out of the lungs. Repeat 5 times if needed. If you are choking and alone, give yourself abdominal thrusts. Bend over a hard surface, like a chair, and thrust it above your navel. If an infant or baby less than 1-year-old is choking, hold face down along your thigh with their head lower than their bottom. Hit firmly on the back up to 5 times to dislodge the blockage. If these actions still don't clear the blockage, call 911.
Tips on what not to do in assisting a choking victim. Number 1. Do not ask them if they're okay. If they're struggling to breathe, they are not okay. Instead, ask them if they are choking, as they may be suffering from something else like asthma, and you will then be able to provide them with the best type of first aid assistance. Number 2. Do not attempt to perform the Heimlich maneuver if you have no knowledge or training, as it can break ribs and damage internal organs. Number 3. Do not put your fingers in their mouth. They may bite you accidentally, and it can further lodge the object in the trachea. And lastly, number 4. Don't pick up the child and turn them upside down.
A nosebleed is a blood flowing from the nose due to internal damage or external force. That is typically caused when tiny blood vessels inside the nostrils are ruptured by trauma on the nose. When you are having a nosebleed, here are some steps you need to do.
1. Sit up straight and lean slightly forward to avoid swallowing blood. 2. Pinch the soft part of the nose just above the nostrils and hold for 10 minutes. 3. Apply a cold compress to the bridge of the nose to reduce swelling. 4. If the bleeding doesn't stop, seek emergency.
Tips on what not to do when having a nosebleed. First, do not tilt your head back or lie flat. This may cause you to choke on blood. Blood in the stomach can make you sick to your stomach and cause vomiting. Second, after a nosebleed has stopped, try not to do the following for 24 hours. Do not blow your nose, pick your nose, drink hot drinks or alcohol, and do any heavy lifting or strenuous exercise.
Cuts and grazes are commonly injuries that can usually be treated at home. A cut is a full break to the skin, whereas a graze is just a top layer of the skin being scraped off. Here are some simple steps you need to do when treating a cut or a graze.
1. When treating a cut, always wear gloves if you have one, or wash and dry your hands thoroughly. 2. Ask the casualty to apply some pressure to the wound using a piece of gauze or a clean towel. 3. If possible, raise the injury above your head to help reduce the flow of blood. If the injury is to a lower limb, lie down and raise the affected area above the level of your heart. 4. Clean the wound under drinking quality running tap water. Avoid using antiseptic as it may damage the skin and slow healing. And gently pat the area dry with a clean towel. 5. Take pain relief if needed.
Stab wounds are serious injuries that require immediate attention. In this demonstration, we'll show you how to stop the bleeding from the stab wound until professional help arrives.
Stay calm and assess the situation. If the person has been stabbed, don't panic. Call emergency services right away. Keep the wound stable. Do not remove the object if it is still in the wound. It might be controlling the bleed. Keep it in place and try to stabilize it. If the object is already out, grab a clean cloth, bandage, or clothing and press directly on the wound. Apply firm pressure to help stop the bleeding. Stay with the person. Remember, stopping the bleeding is critical while waiting for medical help.
CPR is an emergency response technique that its main purpose is to help keep blood moving and circulating so that it continues to reach the brain and other vital organs. CPR can increase the chances of survival for cardiac arrest victims outside the hospitals by 2 to 3 times. CPR combines the movement of chest compressions and rescue breaths to give a person the best chance of survival following a cardiac arrest. When in a situation where CPR is needed, here are some steps on how to perform it.
First, check for responsiveness by tapping the person and shouting. Then, immediately call for help. Next, position the person on their back. Tilt their head back and listen for breathing. Watch to see if the chest is rising and falling. Feel for pulse on the person's neck. If no breathing or pulse is detected, begin CPR. To begin CPR, place one hand over the other and press firmly in the middle of a person's chest. Begin 2 compressions per second or 100 to 120 per minute. Press down at least 2 inches in depth with the heel of your hand. To perform CPR on an infant, use 2 fingers if you are the sole rescuer. Use both thumbs if another person is available to give rescue breaths. Begin 2 compressions per second or 100 to 120 per minute. Keep in mind, compressions should be a bit shallower than those used for adults, but the rate of compressions per minute is the same. Then, immediately call for help by dialing emergency services.
Tips on what not to do when performing CPR. Number 1. Don't administer aid right away. Activate emergency services first. Number 2. Don't bend your elbows when performing CPR. Number 3. Improper chest compressions. Too fast, too slow, or not deep enough can do more harm than good. Number 4. Not staying on beat. If you are worried about your ability to stay on the correct timing, use the well-known Bee Gees song, Stayin' Alive. Number 5. Delivering rescue breaths while being untrained. Inadequate rescue breaths can seriously harm a victim.
And that wraps up our demonstration of the 4 basic first aid skills: treating burns, responding to choking, managing bleeding, and performing CPR. Remember, first aid is not just about knowing what to do. It's about staying calm and acting quickly in emergencies. These simple steps can make a big difference and even save lives. So, take the time to learn and practice these skills because you never know when you might need them. Adios and stay safe.